All right, let's jump right in. Today, we're diving deep into January marketing, specifically for home health, hospice, and private duty agencies.
Oh, cool.
Yeah, it's like a monthly marketing calendar,
Oh, neat.
but it's got a lot more, a lot more zest to it, I think.
I like zest.
And we're going to be exploring some unique angles. We're going to break it down week by week and see how they weave together strategic campaigns for, each of those weeks in January.
I am intrigued already. What strikes me, just glancing at this document, is how it really moves away from that kind of generic, let's buy you lunch approach
Right.
and dives deep into how to provide value.
Exactly.
Especially in healthcare, building trust is everything, right?
Yeah, absolutely. And they give a great example of that. Instead of just, dropping off donuts at a physician's office, they suggest, offering training on like Medicare care plan oversight.
Oh, interesting.
So like really kind of positioning yourself as a resource, for the physician's office, and ultimately that benefits patient care.
Yeah, absolutely. And that's a win-win.
Right.
The agency is positioning itself as the expert. The physician's office is potentially, increasing their revenue streams.
Right.
And the patient ultimately is getting, better care. It's great.
Yeah, it's a far cry from, the old days of just, bringing by a pizza.
Absolutely.
So, okay, let's zoom in on week 1, because this is where I think the creativity really starts to shine.
Okay.
Week 1, they're focusing on vision.
Okay.
And they're aligning that with National Glaucoma Awareness Month.
Makes sense.
Yeah, and so they suggest, partnering with local optometrists, distributing educational materials, and even, get this, private duty agencies can offer services for patients who are recovering from, like, vision-impairing procedures.
Oh, that's a great idea.
Isn't that clever?
Yeah, it's brilliant. They're tapping into a pre-existing awareness campaign.
Right.
And finding this unique niche within it. Like,
Yeah.
Imagine you're a private duty agency and you're reaching out to folks who've just had cataract surgery.
Right.
And they need, help for a couple days or a week or whatever it is. I mean, that's targeted, that's relevant, and it meets, a need. It's perfect.
It's so smart. And they don't stop there. They even suggest collaborating with the Lions Club. The Lions Club
All right.
on like eyeglass recycling and educational initiatives.
Oh, wow. Yeah, I love that. Because they're not just like brainstorming ideas in a vacuum.
Right. Yeah.
They're actively looking for these community resources,
Exactly.
partnerships that can benefit everybody. That's smart, cost-effective, and it builds community ties.
It does. It does. All right. Moving on to week 2.
All right.
We shift gears to Women's Healthy Weight Week.
Okay.
Now, you might think, well, what's the connection to home health?
Right.
But bear with me. So the focus here is on healthy eating, weight management.
Right.
And cleverly, they've woven in things like post-bariatric surgery care for private duty agencies.
Oh, that's great.
So it's about recognizing that, health is holistic.
And home health agencies, especially private duty, they can play a crucial role in supporting individuals throughout that journey.
Absolutely.
Yeah.
Not just when they're, acutely ill.
Exactly. And again, they go beyond just suggesting services. They're like, hey, let's do healthy potlucks, offer diet and nutrition classes, even provide healthy snacks to healthcare professionals.
It's a great way to subtly position that agency as a champion for well-being.
Right.
They're not just selling a service,
Yeah.
It's a lifestyle.
Yeah.
And who doesn't want to be part of that?
That's a great point. All right. Week 3 brings us to National Medical Group Practice Week.
Okay.
And this is where collaboration really takes center stage.
Okay.
They go beyond the typical like thank you ad.
Right.
And suggest co-sponsoring community events, doing like creating joint promotional materials.
I like that.
And they even suggest drafting a resolution for official recognition by, the city council or county.
Wow, that's great.
Isn't that wild? So it's really positioning the agency strategically within that larger healthcare ecosystem.
Yeah, absolutely. Like if I'm a home health agency
Right.
and I co-sponsor a health fair with a prominent medical group
Right.
that instantly elevates my credibility in the community.
Right.
People trust me. They know who I am. It's a fantastic idea.
All right. Are you ready for this?
Hit me.
Week 4 dives headfirst into this whole phenomenon of Blue Monday,
Blue Monday, okay.
which falls January 24th, often dubbed the most depressing day of the year.
Oh, boy.
But instead of shying away from this kind of gloomy concept, They suggest leaning in with a lighthearted approach.
Okay.
So they recommend using a scientific formula postcard to lighten the mood.
Scientific formula.
Yeah, they don't really delve into the formula itself, which I find kind of
I'm
interesting.
very curious now.
But it's more about this idea of like acknowledging this cultural phenomenon
Right.
and using it as a way to positively engage.
Yeah, I love that. This is where they flip the script. Because instead of ignoring, what's traditionally this kind of downer day,
Right,
they're using it to connect with people on a human level.
exactly.
Inject a little humor. Offer some, simple ways to combat the blues. It's a great idea.
It's marketing genius. Like,
Yeah.
instead of trying to combat it, they're like,
Right.
let's embrace this and use it.
Right.
And I love the ideas that they have. They suggest distributing blueberry treats,
Oh, nice.
because it's Blue Monday,
Of course.
doing presentations on, simple strategies to boost mood,
Love that.
even hosting a Beat the Blues exercise class.
It's fantastic. Taking a negative and making it positive.
Right, exactly.
That's marketing.
Yeah, it's all about that positive messaging.
Absolutely.
Yeah,
And it just shows you, even in healthcare, where, it's a serious business, right?
it is.
A little touch of humor, a little creativity can go a long way.
It does. It does. And speaking of, like, providing valuable information, but also keeping things engaging. This document, they don't just stop at that week-by-week breakdown. They've got this whole section on leveraging, other January observances.
Right.
Some are, health-related, and some are a little more unconventional.
Oh, this is my favorite part.
Yeah.
Right, lay it on me.
Okay, so they list everything from, like, Cervical Health Awareness Month, Thyroid Awareness Month, to, like, Bath Safety Month, National Soup Month, and even, wait for it, Hunt for Happiness Week.
Hunt for Happiness Week.
Okay.
I'm already picturing a home health agency hiding little happiness kits around town
Right.
with coupons for a free home safety assessment or something.
Genius.
I love it. But it also makes me think, bigger picture.
Okay.
Like, how can we as healthcare marketers
Mm-hmm.
take these, seemingly unrelated themes
Right.
and weave them into our messaging?
It's a challenge, for sure.
It is.
But that's what makes it fun.
Right.
You got to get those creative juices flowing
that's
and
right.
really think about how to, like, connect the dots in a way that the audience is going to get.
Totally. Like National Soup Month.
Okay.
That could
Yeah.
be a partnership with a senior center, provide some heart-healthy soup recipes, or even just talk about staying hydrated, right? Possibilities are endless.
They are. They are. Okay, but before we go too far down the soup and happiness rabbit hole,
Okay.
we need to talk about the specific approaches they outline for hospice and private duty,
Okay.
because this is where it gets super specific. It's
Right.
like they created, like, mini marketing manuals within this document.
It's for good reason, right? Hospice and private duty,
Totally.
you need a different approach.
You do.
You're dealing with different, sensitivities and situations.
Right. So for hospice marketing, they recommend this, like, three-pronged approach.
Okay.
Targeting different segments, the general community, non-clinical decision makers.
Right, like family.
Right. Family members, clergy,
Right.
and then clinical referral
For
sources.
doctors and hospitals.
Exactly. So they're saying, each group needs a slightly different message. Right.
Because they have different levels of understanding about hospice care.
Absolutely. So, like, with the general community, it's more about awareness,
Right.
demystifying what hospice is,
Mhm.
talking about the compassionate support,
Right.
maybe partnering with, like, grief support groups or something.
Yeah, or even just offering, like, educational seminars.
Right. Be a resource for the
you
community.
Build that trust.
Exactly.
And then for, like, those non-clinical decision makers.
Right.
Who are often, family members.
Right. They're vulnerable,
They are. And they're grappling with some tough choices.
Yeah. So you need to provide that information in a way that's sensitive and compassionate.
Exactly. And then think about things like brochures, websites, FAQ sections.
Oh, FAQs. I love FAQs.
That are specifically for families, like,
Yeah.
how do I know when it's time to consider hospice?
Hmm.
Or what kind of support can my loved one expect?
It takes so much anxiety out of the process.
Right.
People just having that information easily accessible It does. It does. And then when you shift to those clinical referral sources, it's a whole different ballgame.
Okay.
Now you're talking about expertise,
Right.
highlighting your track record.
Right.
You really want to build strong relationships with those physicians and discharge planners.
Absolutely. You got to speak their language.
Yeah.
You got to provide that data.
Right.
Show them you understand the healthcare system.
Right. You're a partner.
Exactly.
Okay, now let's talk private duty,
Okay.
because they take a very different tack.
Right.
They're all about direct marketing with super targeted lists.
Oh, targeted lists. This is like marketing chess.
It is. It is.
But-
They're not just casting a wide net.
Right. You're not using a shotgun.
No.
You're using a rifle.
Exactly. And they literally use that analogy in
Yeah.
the document.
Okay.
And it's so true. Like, you're pinpointing potential clients based on, their needs, maybe their chronic conditions, even income level.
Income level. Okay. Now we're getting fancy.
I know, right?
But it makes sense.
It does.
When you're talking private duty, you're talking about highly specialized services, right?
Yeah.
So you got to be specific.
You do. Like, imagine you're a private duty agency and you specialize in post-stroke care.
Yeah.
You could send mailers to people who have recently been discharged from the hospital after a stroke.
Boom. Straight to the source.
Right.
You're not wasting time. You're not wasting money.
Right, and it's ethical.
Yeah, and it's ethical because you're offering a solution to a problem that people have
Exactly.
at the time they need it most.
It's about making those marketing dollars work as hard as they can.
It is. And honestly, I think this strategy goes beyond healthcare.
It does.
This can be applied to anything, right?
Anything.
Any industry where reaching the right people at the right time is critical.
Right.
Think about it.
It's brilliant.
It really is. But it does, it raises some interesting ethical considerations as well.
Oh, hold on a second. Are we going down a philosophical rabbit hole here?
Oh, maybe we are.
Because that's a whole other conversation.
You're right. Back to marketing.
Yeah, let's stick to the document.
Okay,
But it is, food for thought.
for sure.
Okay, so back to this marketing brilliance.
All right.
They have covered a lot.
They have. We've gone from awareness campaigns.
Mm-hmm.
We've talked about physician outreach, specialized strategies. We've talked about direct marketing. It's a toolbox
It's a toolbox.
full of innovative ideas.
And practical strategies.
I'm inspired.
Me too. But it does raise a big question for me.
Okay, what's that?
With all this information out there, how do home health agencies really break through the noise
Right. How do you stand out?
and connect with the right people?
That's a great question. And I think this document, even though it's full of these tactical ideas,
Mm-hmm.
it also hints at this deeper truth about marketing.
Okay.
It's not just about the campaign. It's not just about, partnerships.
Right.
It's about connecting with people.
Human connection.
Yeah, remembering that behind every potential client, every referral,
Mhm.
every person in the community, there's a human being
Right.
with needs and worries and hopes.
Right,
'Cause
absolutely. And in healthcare, those needs are often so much greater.
Yeah,
They're, tied up with uncertainty and vulnerability, this
Right.
desire for support.
and compassion.
Right, exactly. And so this document, maybe without even realizing it,
Yeah,
it's highlighting how important it is to meet people where they are,
right.
understand their situation, and offer solutions that actually make sense for them.
It's like that saying, people don't care how much you know until they know how much you care.
That's so true, especially in healthcare. Obviously, expertise matters,
Sure.
professionalism, all that,
Of course.
but you can't forget about empathy,
Right.
compassion.
Making a difference.
Yes. And this document, with all this talk about targeted messaging, engaging with the community,
Building relationships.
it's like a roadmap for how to do that.
Yeah, it is.
Yeah.
And it's not about tricking people.
Right.
It's about earning their trust.
Yeah, showing your value.
Being that trusted resource.
Exactly. And it makes you think, if this can work in healthcare, with all the regulations and complexity,
I know, right?
what about other industries?
Absolutely. Any business
Any organization?
could benefit from being a little more human,
A little more human. I like that. It's about building relationships,
not transaction.
understanding your audience,
Anticipating their needs.
offering real solutions.
Yeah. And in a world that's just bombarded with marketing,
Right.
that's how you stand out.
Well said. All right, folks, that brings us to the end of our deep dive into January home health marketing.
It's been quite a journey.
It has. We've explored some creative ideas,
Practical strategies.
maybe even pondered some bigger questions.
Along the way,
Hopefully you've learned a thing or two.
maybe had an aha
Yeah.
moment.
And that'll spark some of your own marketing magic.
Remember, the best marketing is thoughtful.
Authentic.
And above all, human.
Couldn't agree more. Thanks for joining us on this deep dive.
See you next time.
And until then, keep those marketing wheels turning. Turn it